I'm Dr. Andrew Vallance Owen. I'm chairing an organisation called the Private Healthcare Information Network, and I'm also chairing a session at the conference.
What makes HC 2013 or 14 a special conference for people who are interested in health informatics to go to?
Well, I think it's really important these days to bring together the information people and the technology people, and this is what the conference does. You know, these days in healthcare, information or data leading to information, leading to helping people make choices, helping people commission care, is absolutely crucial. And those two go hand in hand together, and they're both together at the conference.
Why do you think people working in the health industry should go?
I think it's the issue which is going to take healthcare forward. Getting information technology, information integrating across hospitals, commissioning groups, the third sector and the private sector where I come from. We're all in healthcare together and we need to be integrated, and I think this conference tries to bring together all those groups, the technology and the information people. It's a really important conference, I think.
Now, quite a few people have told me that HC seems to be getting a more international feel. Do you agree with that, and do you think that will be the case for future years to come?
Well, there's a huge amount of great work being done in other countries. I travel a lot for the government, and I think that we've got a lot to learn from them, but we've been doing good things here too. So I'm all for international collaboration, and I think it will benefit us here certainly if we bring in the expertise from overseas.
What do you think are the major issues at the moment for information and IT within the new healthcare system?
Well, I think one of the biggest things is understanding how we're delivering our healthcare. Are we delivering it effectively? I'm a doctor myself, and I'm passionate to know whether my patients, if I was actually in practice, are getting better or not. So measurement of outcomes. You know, are we delivering the right outcomes? And you need to collect data to know that, to be able to case mix adjust, to bring it all together. So one of the big issues in healthcare is outcomes, and in fact value in healthcare is measurement of outcome over the cost. And you know, we're really good at measuring the financial side. We've been less good at measuring outcome, and I think that this conference will be one place where we can really bring those two together.
Do you think that information technology is becoming more essential, a more important part of the NHS services that we see today?
I think information technology has always been an important part, but perhaps it hasn't been given the priority it should have been. And I do think that, especially with the restructure in the National Health Service, it's going to be even more important with all these different organisations setting up. Information can bring them together. Information shouldn't drive the strategy, but the strategy definitely needs support from information technology. So it's a crucial time.
Can you tell me a little bit about the thread that you'll be presenting in yourself?
The thread that I'm chairing is about involvement of the third sector and the private sector. And in fact, the organisation I chair is supporting that section, which is the Private Healthcare Information Network. To some extent, the National Health Service is slightly ahead of the game in publishing clinical data and enabling patient choice. And so one of the things we're trying to do in my organisation, and I think the third sector needs to do as well, is to get up with the game and to be as good at publishing information about mortality and readmissions and outcomes as the NHS is. And so our stream is about trying to bring those two sectors up to speed.
Well, do you think that the private sector and the public sector can learn from each other with regards to health informatics?
Oh, I'm absolutely convinced that we can learn from each other. The private sector is ahead in some ways, certainly in the thinking about use of information. I mean, informed choice, customer choice is absolutely crucial in the private sector. But they haven't been so good at collecting the data. On the other hand, the NHS is collecting really good data now on outcomes, but perhaps hasn't been so good at putting it out to what I call the customer, the patient. So there's a lot of learning for both sides, I think.
Health informatics has sometimes been seen as a bit of a bolt-on extra to the health service in general. A bit like IT security is obviously sometimes seen as a bit of a bolt-on to a normal organisation's business running. Do you think that the general perception of health informatics has changed over the last 5 or 6 years?
I think it has. I think it went through a rather geeky phase, health informatics, and people thought, is that really relevant to us? But I think that the strategy now, and the strategy must always lead, demands information for customers, for commissioners, for people working in hospitals, and therefore to support that strategy, people have become to realise that informatics and information are key to the strategy. So I don't think they're seen as a bolt-on, they're seen as pretty integral to driving strategy in healthcare.
What do you think are the main challenges for health informatics going forward over the next few years?
I think integrating systems. I think the big challenge, we've got sort of reasonable structures in informatics in hospitals, to some extent in commissioning groups, to some extent in the private sector. But getting this as an integrated proposition is really important. And informatics, I think, can help us bring together the commissioners and the hospitals. And that will be the challenge. And it will be so much more efficient if we can do that properly.